Hey guys, this is Dr. Cameron Dennis, a physical therapist for Back on Track Therapy and Wellness. And today I wanted to talk about runner's knee. So, the last couple days we've been going over the different types of knee pain, starting with the anatomy, going to the causes of the knee pain, and then going through the treatments. For this video, we'll go through the cause and potential treatments for runner's knee. And like all musculoskeletal pain, I'm just going to start off by pointing out that it's multifactorial. There's very rarely just one cause. Very rarely is it just one muscle that's weak. Is it one muscle that's tight? In general, it's going to be multiple things. So it's potentially a group of muscles that's not functioning properly. They might, you might have the muscles of the posterior leg, the hamstrings, the glutes that are weak, as well as tightness in another region. You might also have increased stress in your life. You might also have poor diet, poor sleep habits, improper footwear, poor resting habits, things like that are causing it. So I don't want you to think that it's always going to be one thing that's going to fix your problem, and in this case, runner's knee. A little bit more about runner's knee. It's also called patellofemoral pain syndrome, so PFPS. You might see it abbreviated as sometimes. And what happens is, as you know from the anatomy video, if you already watched that, what you have is you have your femur. Okay, it's right here. At the bottom, you have these two condyles, these two little notches that come in contact with the tibial plateau, or the top of the tibia, just like this, okay? And right here, in between there, you have your menisci, okay, medial and lateral. And what you have is the kneecap, which runs up and down in between these two condyles, or these two notches. Okay, just like that. So when you flex and extend your knee, it slides through there, just like that, just right over the top. And what you can have is if you have, for example, excessive internal rotation at the hip, even if it's just a little bit, what you can have actually is grinding, I shouldn't say grinding, increased pressure between the condyles, lateral condyle, so the outside of the femur, and the outside of the patella or kneecap. Okay, so if it's not gliding properly, if it's slightly brought over, because this part is internally rotated, this part is the patella is going to be rubbing on that outside of the femur, if that makes sense. So basically, when you have excessive or increased pressure on the inside, or on the inside of the kneecap, sometimes that'll cause pain, or at the very least irritation or inflammation. So basically what we want to do is decide what the problem is, right? So you need to evaluate, first off, your glute strength. If you know that you have glute weakness, if you know that you have hamstring weakness, you want to start to address those things, okay? Before you even get into a lot of the strengthening exercises, you might want to think about your diet. Make sure you're eating healthy. I know Brianne Showman Brown's going to go into the diet and things a little bit this week, so be sure to check those out. But a healthy diet's crucial, okay? Make sure you're getting your sleep. Make sure that you're managing your stress appropriately, okay? Because we need to calm things down before we build them back up, right? So to calm that down, you can try ice, you can try heat. It depends on how long it's been bothering you. If it's fairly new, the general recommendation is going to be ice, but in my opinion, it really comes down just to your preference. If you find that ice helps, do ice. If you find that heat helps, do that, okay? While you're icing and heating, try and keep that leg elevated. That's one thing that seems to be helping. You might even try light massage if that's something that's helped. Applying like a biofreeze or something like that. So once it's calmed down, okay, once that pain is somewhere between we'll say less than 4 out of 10. So we want it to be on that lower range to be considered calmed down. Okay, if that pain starts to go above a 5, with 5, 6, 7, with activity, and especially with at rest. If that pain is above a 5 at rest, it's not calmed down enough. Okay, so you want to get that pain lower than 5. If it starts creeping up above 5, even with exercise, it's probably not calmed down quite enough. Okay, so and if you're having trouble with that first stage, you might try aquatics. You might try cycling, different types of cardio, just ways to get that knee moving in ways so that you're not completely resting and losing a lot of your strength and a lot of those gains that you've been working on. So once you get it calmed down, you're going to start strengthening, right? So you need to decide where you're weak, okay? In the case of patellofemoral pain, or what we call runner's knee, what we see a lot of times, and it's not always the case, but what we see a lot of times is weakness of the glutes, weakness of the hamstrings, and tight hip adductors, okay? So you can do the butterfly stretch. You can stretch those muscles of the inner thigh. If you have any questions about how to do that, let me know. Strengthening the glutes, you can start off with bridges, supine bridges it's called. You can move that to one-legged supine bridges, go into lunges, squats. You can use resistance bands and put it around your knees, and sidestep. There's tons of different things you can do to strengthen the glutes. Deadlifting, squatting, the more advanced exercises as you get a little bit further, as the strength starts to reach those higher levels, you can do those higher level exercises. Also for the hamstrings, deadlifting is good for that. Hamstring curls with your feet propped up on a exercise ball, you might try those. So the other aspect of that would be changing your running mechanics. And I know we've talked about this a little bit, but increasing your step rate is one way that you can reduce the strain on the knee. So increasing that step rate to you can increase it about 10% or so, see if that helps with the knee pain. Another thing that we know helps decrease strain on the knee and on the anterior aspect of the leg is running uphill. So running uphill puts more strain on the Achilles, it puts more strain on the calf, the glutes, the hamstrings. Running downhill puts more strain on those anterior structures, so like the muscles of that flex the toes up, as well as the quads and the IT band. So increasing your step rate is one thing you can do. But the other thing is to make sure that you are training smart, if that makes sense. I'm not sure how to word that, but training smarter, right? So making sure that you're getting you're not just doing all distance days, right? You're including days where maybe you're training hills, or maybe you're doing a track day in there. You're doing interval days. You're not just going out for 25 miles 4 times a week. Even if you're training for an ultra, you really need to get that variability in there so that you're not continually straining those same structures and not allowing them to rest. So I know this video was a little bit longer, but hopefully you found it helpful. If you do have any questions, please feel free to reach out to me. Once again, my name is Dr. Cameron Dennis, physical therapist for Back on Track Therapy and Wellness out here in Wapakoneta, Ohio. If you are struggling with any musculoskeletal injuries from either running or exercise, or just from daily living, please feel free to reach out to me, and hopefully I can help you out. Also visit my website at backontracktherapy.com or facebook.com/getbackontracktherapy. Okay, so thanks for watching.